Roger, assuming your business is registered, compliant, open for business, then what do practitioners need to consider when it comes to the marketing of their services, and what information needs to be readily available for clients?
So again, it comes down to this detailed description of what's available and what can and cannot be expected. So far as the CQC is concerned, successful registration means you're obliged to notify patients of that. So there'll be a CQC compliant sticker or poster that needs to be on the premises. With it comes the understanding that there will be publicly available regular screening and audits. It imposes a duty of candour, not that that's new to medical professionals because they have that anyway, but the CQC specifically mentioned that as one of their requirements. But I would make an absolute positive statement to say we are CQC registered, include a link to the CQC so those interested can go along and see what it actually means. And that's yet another, kite mark of quality and assurance of independent oversight to consider that consistent and improving patient care is evidenced. So, yeah.
And I think just in terms of the overall, so particularly for functional medicine marketing, it's all about clarity as to what you're offering and what treatments you're offering. And interestingly, as Peter Attia says in Outlive, which we mention from time to time, because you're moving to this prevention, so you need to really set out exactly what sort of treatment, what sort of service you're offering, what sort of results you expect. If you are using less proven or less accepted techniques, you have to make that absolutely clear, and you have to make sure that patients really on consent, that they really understand the risks and benefits of those specific treatments, and you need to make that fairly clear, fairly upfront.
Yeah, so I guess just very quickly to evolve this, there are probably 3 categories or classes of information that you need to get over if you're CQC registered. One is the marketing, where you are on the high street, broadly what you offer and what you don't. Then we get into this vexed question of terms and conditions and how do they differ from your marketing and how do they differ from consent. So terms and conditions are broadly what people can expect by way of an interaction, what your obligations are, what their obligations are, and it comes down to the nuts and bolts. So is there, for example, an appointment cancellation policy? So are you going to charge someone a fixed fee if they can't make an appointment with and they don't give you, say, 48 hours or 24 hours advance notice? And then we get down to the real nitty-gritty, which is the consent documentation, because you have decided as the FM doctor that you think it's in the patient's best interest if you do X. So you need to define X and you need to go through X is going to be more beneficial than risky, all the usual criteria. So you might want to think about it as 3 categories of information. There's marketing, terms and conditions, consent.